Currently, the fundamental cause of asthma is unknown. According to the World Health Organization, asthma is caused by a combination of genetic and environmental factors. There are generally 3 types of asthma. These types are based on the triggers that induce a person's asthma attack. Exercise-induced asthma is triggered by changes in temperature to extreme cold and/or extreme heat. Allergy-induced asthma is triggered by specific allergens, such as pet dander, cockroaches, or pollen. Occupational asthma is triggered by pollutants in the air, such as fumes, gases, dust, and smoke. Asthma is a chronic disease. During an asthma attack, the pulmonary airways become inflamed, which causes the airflow to decrease in the bronchioles. This is described as lower airway obstruction that is usually reversible. Now let's go inside the body and visually observe what happens during an asthma attack.
Normal breathing involves many areas in your body. The air goes in through your nose and mouth, then down the main airway. This airway then branches into 2 smaller airways, taking the air into each lung. These then continue into smaller airways, which take the air deep into the air sacs of your lungs. Your small airways are surrounded by muscle bands, and on the inside there are mucus glands. Normally, the muscles of these airways are relaxed, and the air moves easily in and out of the lungs. People with asthma have airways which are often sensitive, inflamed, and irritable. These airways then react to things called triggers that set off their asthma. Their airways swell and get thick with mucus, and the muscles around the airway squeeze tight. This makes it hard to breathe.
Long-term effects of asthma are dependent upon the severity of the condition. Even though asthma is described as a chronic condition, a person may experience long periods of time where his or her symptoms are abated. This is also known as remission. In comparison, people living with chronic asthma have a gradual decrease in the function of his or her lungs. This is especially true for those who smoke tobacco, and those who have excessive amounts of mucus production. This picture depicts what an asthmatic airway looks like in comparison to a normally functioning airway. The airway on the far left is the normally functioning airway. The muscles in this airway are relaxed, and the mucus is not blocking the airflow. The airway in the middle is of an asthmatic airway. The muscles in this airway are more contracted, which slows the movement of the mucus, thus creating a disruption in the airflow. Finally, the final airway depicted on the far right is what an airway looks like during an asthma attack. The air becomes trapped in the alveoli, also known as the air sacs in the lung. Also, the smooth muscles lining the bronchioles becomes tighter and thicker. During this stage of asthma, the person will experience severe shortening of breath, influx in heart rate, panic, as well as chest pain and/or tightness.
Symptoms of asthma can develop at any point throughout a person's life. Prior to the age of 18, the person will be diagnosed with childhood-onset asthma. If the person is 18 years old or older, the person will be diagnosed with adult-onset asthma. Women are more likely than men to develop asthma after the age of 20. Harvard Nurses' Health Study found that women who take estrogen supplements after menopause for 10 years or more are 50% more likely to develop asthma than women who never used estrogen.
Inhalers are the main treatment for asthma. The inhaler provides the most effective treatment, because the inhaled medicine goes straight to the airways. An emergency asthma scenario is when someone experiences an asthma attack and does not have his or her inhaler immediately available. Therefore, it is imperative that someone living with asthma remembers to take the inhaler everywhere.
An occupational therapist can help educate someone with asthma on different ways to remember his or her inhaler prior to leaving the home.
Seven out of 10 accidents during medical intervention occur because the medical staff is unaware of the person's pre-existing conditions. To assist in preventing an accident occurring during a medical emergency, an occupational therapist can assist the individual living with asthma in creating an asthma action plan. These action plans provide the individual's emergency contact information, as well as the type of asthma the person has. The action plans can be wallet size for easy transportation. In combination with appropriately prescribed medication, regular exercise should be encouraged for all asthmatics. A physiotherapist can tailor an individualized plan, consisting of 3 to 5 times per week for an average of 30 to 60 minutes of exercise. Swimming and team sports with short, intermittent bursts of activity have shown the best results in terms of exercise for severe asthmatics. Effective exercise is important, because inactivity may lead to obesity. Also, inactivity increases someone's risk for developing other chronic diseases,